I'm going to try and get through as many as we can. Sarah's been in touch on 4001 saying, my dog is going for surgery. The vet is asking for pre-blood work. How necessary is this, and which ones would you recommend for orthopedic surgery? Okay, can you tell me if I first of all said that correctly and what orthopedic surgery is?
Orthopedic surgery is extremely important. We have to see the blood work to see if the kidneys and the liver, it works properly to remove the anesthetics from the body. CBC and biochemistry together are the main key to have a healthy and safe surgery, especially surgery over 30 minutes time.
Mm-hmm. This is more a behavioural question, but I'm wondering if you can shed some light on it. Our small dog is nearly 6. We got her as a puppy. She had big dog and cat as her companions. The three of them made a little pack and would play together. Our cat sadly died in January. Small dog was sad, but clung more to big dog, who sadly passed in June. Since then, small dog has been really unhappy. I've tried everything, new interesting walks. She won't go into the garden by herself. She won't play. She won't go to the toilet in the garden. So we do more walks that she doesn't enjoy. Appetite remains unaffected, thankfully, but she howls if I go upstairs or into the garden and is constantly demanding food or attention. She goes crazy with excitement if she sees another dog on a walk, any dog, and then whimpers all the way home. Life is, in a way, easier with only one, but I think she doesn't know how to be alone. The vet has suggested antidepressants, and I don't know if medicating her is the answer. If Andrea and small dog came into clinic, what would you be suggesting, Doctor?
Just for some people with depression, fresh air, stay with your friends, and adopt another dog as fast as possible. This is a cycle of life. So animals are not, I love animals and this is my profession, but animals teach us that one day we are the next. Unfortunately, I advise him to adopt a kitten. We need a lot of people to adopt animals at the moment. My advice is help somebody else that in need it in any shelter or adopting any kitten. I have 3 at the moment for you. If you want to adopt a dog, I have a dog straight away for you.
Okay. To add to the family. Okay, all the very best, and give small dog a squeeze from me. We've got another Helen on the line now. How are you, Helen? I understand you've got an itchy bulldog, so to speak. What's going on? What's the name of the French bulldog and what's been going on?
My Lulu, Lucy, she is 6 years old and she has an incessant itch in her ears. It's been treated, creams, sprays, antibiotics, blood work, cones on for about 3 to 4 months. It just seems like it's a habit more than anything else. We've changed foods. She went for a stage of eating salmon and steak and everything else and all the veggies. She's very fussy with her food, so we give her what she likes to ensure she eats. We're just at a loss now because it's just constant scratching and we try to stop it, but nothing we do works.
Okay.
Any advice?
It sounds like you've run the full gamut of tests and treatment, and it's interesting thinking that, is it habit? Is it, a bit of a behavioural tick, so to speak? But Dr. Sergio was saying maybe not. If Helen was going to come in, by the way, we're both called Helen. We've both got 6-year-old dogs called Lucy. Weird. So if Lucy and Helen were going to come into your clinic, Dr. Sergio, and given this history that she's provided now, what would your next step be?
First of all, we do a allergic test. I believe this is very much, looks like she has some issue.
What kind of things would a bulldog be allergic to, French bulldog?
Can be allergic to many things. I got one French bulldog. He was allergic basically to all kind of protein. He wasn't allergic to egg and fish only. And most of the diets are based in chicken. And we have chicken or chicken meat, and it's okay.
So when it comes to the gold standard then of allergy testing, what is done? Can you walk us through what you'd be, taking samples of and ultimately what you're looking to identify?
We have one test that I like it. I don't want to say the name of the company, but just to let you know. And we can, for all aspects, not only one kind of protein, but basically all the allergic possible, so chlorine, tests, minerals, and this is the full panel. It's very complete, I think so. Give to her free consultation.
Yeah, absolutely, Helen. Okay, I'm going to send you Dr. Sergio's details on the text line so you can connect. And at least that way we can, get that medical side addressed. If it does come down to a behavioural thing, let's get Dr. Katrin on from German Veterinary Clinic because she's a real expert when it comes to the kind of psychology of pups as well. So let's rule out the allergy side with Dr. Sergio and then we can look at the behaviour. Does that make sense?
And Helen, just to let you know, could be both.
Yeah. Okay. All the very best, Helen. Thank you so much for getting in touch. And hi to your Lucy as well. Right, we've run out of time. I knew it was going to go fast. So we had so many questions. Anything that we couldn't get to today, I will put in the pot for next week's Pets and Vets. Dr. Sergio, in the meantime, where can people find you, both in real life and online as well?
Online, I have my Instagram. We have our Facebook page in the clinic, and our clinic is located to Owasso Road, Villa 1234.
That's easy to remember.
Yeah, very easy.
Thank you so much. If you want
Helen,
Dr.
thanks a
Sergio's
lot.
details, just send me the word.
Can I
and
say
will-
hi to my family?
You can say
Hi.
hi to whoever you want.
Bye, Dudu. Bye, Flavia. Bye, Mariana, my kids.
Oh,
Bye, my
I
dogs.
love
Bye-bye.
it. Bye, gang. He's a superstar, your dad. Dr. Sergio from Intervet.